Did you know pancreatic cancer is one of the most dangerous cancers today, even surpassing breast and prostate cancer in terms of mortality in many countries? It sounds strange because this disease is hardly mentioned much, but because of that silence, tens of thousands of people each year do not detect it until it is too late. In today's video, you will learn 8 early warning signs that most people ignore, and knowing this information can help you or your loved ones detect this dangerous disease before it is too late. Watch the whole video, because just recognizing 3 out of 8 signs, the chance of early detection has increased by nearly 70%. If you are interested in health and want to update useful knowledge, don't forget to follow the channel so you don't miss the next important shares. Symptom number 1, digestive disorders. Warning signs of pancreatic cancer. Digestive disorders are a common symptom that everyone has experienced. However, what is worrying is that prolonged unexplained digestive disorders can be an early warning sign of pancreatic cancer, one of the most dangerous and difficult to detect diseases. The pancreas plays a key role in the digestive system. It produces digestive enzymes that help the body break down and absorb fats, proteins, and carbohydrates. When a tumor appears in the pancreas enzyme, production is affected, causing food to not be digested properly. This leads to a series of digestive disorders that patients often ignore or confuse with common disorders. Digestive symptoms that need special attention include prolonged nausea even when not eating much, feeling full and bloated even when eating little, loss of appetite leading to unexplained weight loss, diarrhea, or abnormally shaped stools, especially pale, foul-smelling, floating and sticky stools, signs of poor fat absorption due to a lack of pancreatic enzymes. These are not just mild or temporary disorders. When the pancreas is damaged, the ability to absorb nutrients is seriously affected, leading to energy deficiency, impaired immunity, and gradual exhaustion of the body. What is worrying is that many people think that this is just due to irregular eating, stress, or age, so they do not go to the doctor. This has delayed the golden period to detect the disease when it is still under control. Expert advice: if you see a clear change in your digestive system for a few weeks or months, especially if the symptoms persist despite changing your diet or taking regular medication, do not be subjective. Go to the doctor early to thoroughly check your pancreas, liver, and digestive system. A small check today can save you from a big consequence tomorrow. Symptom number 2. Persistent fatigue, a silent but dangerous signal. Everyone has experienced fatigue after a stressful day at work, lack of sleep, or overexertion. But when your body falls into a state of prolonged, persistent fatigue for no apparent reason, it can be a sign that should not be ignored, especially when related to pancreatic cancer. This type of fatigue is completely different from normal fatigue. You can get enough sleep, rest properly, but still feel lethargic, lack of vitality, unable to concentrate, and always have a feeling of exhaustion from within. Even simple activities such as walking, climbing stairs, or carrying light objects become a burden. This is a very common phenomenon in pancreatic cancer patients in the early stages, but is often confused with stress or old age. The underlying cause is that cancer cells not only grow rapidly, but also consume a lot of energy and nutrients in the body. This causes healthy cells to no longer have enough fuel to function effectively. As a result, the patient always feels weak, even debilitated, even though there are no other obvious signs of illness. Not only does it affect the physical body, prolonged fatigue also has a serious impact on the spirit. Many people fall into a state of depression, anxiety, insomnia, or poor sleep. This creates a negative loop, causing the body to become increasingly exhausted without the patient understanding the cause. It is important to note that fatigue related to pancreatic cancer often does not improve even if you rest or change your lifestyle. If you feel tired for no reason, for several weeks to several months, accompanied by symptoms such as weight loss, digestive disorders, or poor eating. Do not ignore it. This can be an important early sign of a serious problem inside your body. Remember, the difference between normal fatigue and pathological fatigue is how long it lasts and how it doesn't improve. If you find that fatigue is a permanent part of your life, even if you haven't changed your lifestyle, be sure to seek medical attention. Don't wait until your body is breaking down before taking action. Symptom number 3. Fever and chills. Your body is alarming you from within. Why? When it comes to pancreatic cancer, few people think that fever and chills can be one of the early warning signs, because these are common symptoms of many common illnesses such as flu, sore throat, or infection. However, when these fevers are repeated without a clear cause, appear erratically, and do not respond to conventional treatment, you need to seriously reconsider your health condition. In pancreatic cancer, fever is not simply a reaction to bacteria or viruses. It is also the result of chronic inflammation inside the pancreas or the hepatobiliary system. When the tumor begins to grow, it can block the bile duct, interrupting the flow of bile from the liver to the small intestine. This blockage creates favorable conditions for bacteria to grow and cause inflammation. The body responds by having a fever sometimes, accompanied by chills, night sweats, and a feeling of having a cold that lasts a long time and doesn't go away. It is especially noteworthy that the type of fever in pancreatic cancer is often unstable. You may find yourself feeling unusually cold during the day, then having a high fever in the evening or at night. These fevers can come on suddenly, last for a few hours, then disappear, but then return. This is an uncontrolled inflammatory response from within the body, not simply a common cold. Many people make the mistake of buying fever-reducing medicine to take for a few days and then ignoring it. But when your body temperature keeps changing for no reason, especially if the fever is accompanied by persistent fatigue, dark urine, or mild jaundice, it is time to see a doctor for a comprehensive examination. These are symptoms related to the pancreas, liver, and biliary system, organs that are directly affected when a tumor develops in the pancreas. In addition, a prolonged fever of unknown origin can also weaken the immune system, making you more susceptible to infection and damaging many other organs. Therefore, the longer you go without a diagnosis, the lower the chance of effective treatment. Practical advice: never ignore an irregular fever that lasts more than a week. When you feel that something is wrong with your body but cannot explain it, trust that feeling and take the initiative to get checked. This caution may help detect the disease at an earlier stage and save your life. Symptom number 4. Blood clots. A silent but terrifying danger. When thinking about pancreatic cancer, few people think of blood clots as a warning sign. However, this is one of the hidden but extremely dangerous symptoms that can occur before the disease is diagnosed. This condition is not only more common than you think, but also an important warning factor that many people ignore. In a normal person's body, the blood clotting system operates in a balanced mechanism, enough to stop bleeding when necessary, but not to form excess blood clots. However, in people with pancreatic cancer, this balance is broken. Cancer cells can trigger inflammation and produce substances that increase the risk of blood clots. This condition is called hypercoagulability, and it is especially common in people with pancreatic tumors. A common form is deep vein thrombosis, DVT, which usually occurs in the legs. Common symptoms include unexplained swelling of the legs, a feeling of warmth and pain when touched, and the skin may turn red or purple. Many people mistake it for a minor injury or venous insufficiency, so they do not pay attention and ignore it. However, if part of this blood clot breaks off and travels to the lungs, it can cause a pulmonary embolism, a life-threatening condition in a split second. Signs of a pulmonary embolism include sudden shortness of breath, severe chest pain when taking a deep breath, rapid heartbeat, and an unexplained feeling of panic. In many cases, patients do not know they have pancreatic cancer until they are hospitalized for pulmonary embolism, and by then, the disease is already in an advanced stage. Not only that, blood clots can also form in other locations, such as the arms, lungs, and even in the abdominal veins, depending on how far the tumor has spread. This shows that pancreatic cancer not only affects the local area, but also disrupts the entire circulatory system in the body. Remember, if you or a loved one experiences unexplained leg swelling, mild but persistent pain, or unusual shortness of breath, get checked out right away. A simple blood test, vascular ultrasound, or CT scan can help detect blood clots early, leading to a more timely diagnosis of pancreatic cancer. Symptom number 5 of swollen liver and gallbladder, a direct result of pancreatic tumors. One of the silent but highly diagnostic warning signs of pancreatic cancer is the abnormal swelling of the liver or gallbladder. This is not a common symptom in common disorders, and when it occurs, it is usually the result of a blockage of the bile duct caused by a pancreatic tumor. To understand this, you need to know that the pancreas, liver, and gallbladder are 3 organs that are located close to each other and are closely connected through the bile duct system. When a tumor develops in the head of the pancreas, near the common bile duct, it can compress or block the flow of bile from the liver to the small intestine. As a result, bile is retained in the liver and gallbladder, causing abnormal swelling. A normal gallbladder is only the size of a small lemon, but when it is blocked, it will continue to accumulate bile without being able to drain, causing the gallbladder to enlarge, sometimes palpable, under the right upper abdomen. Similarly, the liver can also become enlarged and tense, causing a feeling of heaviness or dull pain under the right ribs. In some cases, patients do not feel obvious pain, but only notice a hard, full, and persistent abdominal discomfort. These changes are easily overlooked or mistaken for symptoms of digestive disorders, especially in the elderly. Imaging methods such as ultrasound, T-scan, or MRI can quickly detect abnormal enlargement of the liver and gallbladder, and more importantly, if combined with other signs such as dark urine, jaundice, fatigue, the doctor can promptly suspect and detect pancreatic cancer at an earlier stage. One factor that makes this symptom dangerous is that it often does not cause obvious pain, so patients easily ignore it. It's only when complications arise, such as cholecystitis, bile duct infection, or liver toxicity, that people seek medical attention, and by then, it may be too late for the most effective treatments. Symptom number 6. Bloating abdominal discomfort. When feeling discomfort is a signal from the pancreas. Feeling bloating abdominal distension is one of the conditions that many people encounter in daily life. After a full meal, a little unsuitable food, or due to the habit of eating quickly, we often feel the stomach bloated, uncomfortable, and heavy. However, if this condition occurs continuously, lasting even though you have adjusted your diet, and especially without a clear reason, this could be one of the early warning signs of pancreatic cancer that you should not ignore. The pancreas plays an important role in the digestive system through the production of enzymes needed to break down food. When a tumor appears, the activity of the pancreas is hindered, causing the digestive process to stagnate. Food is not thoroughly processed, leading to stagnation in the stomach and intestines, causing a feeling of fullness, quickly prolonged bloating, and even mild nausea after eating. A typical sign of pancreatic cancer is the feeling of early satiety. You have only eaten a few bites, but already feel like you can't eat anymore. This feeling is not the same as the usual fullness after eating too much, but a feeling of fullness and discomfort in the upper abdomen, sometimes lasting all day. In addition, the abdomen may feel bloated, difficult to pass gas, and heavy as if something is pressing on it from the inside. It is worth noting that this symptom is often confused with mild digestive disorders, improper diet, or stress. Many people choose to self-treat with digestive enzymes, anti-flatulence medication, or dietary adjustments. But if after 1 to 2 weeks the symptoms do not improve, it is time to suspect a deeper cause from the pancreas. A tumor in the pancreas not only reduces digestive function, but can also compress neighboring organs, such as the stomach and small intestine, leading to a constant feeling of fullness in the abdomen, even when the stomach is empty. This is one of the symptoms that patients are most subjective about, but has diagnostic value if detected in time. Symptom No. 7: abdominal pain or back pain, when pain is no longer normal. Abdominal pain or back pain is a common symptom in daily life, especially in the elderly or those with a sedentary lifestyle. However, when the pain appears dull, persistent, has a special nature, and does not improve despite rest or medication, it is very likely an early sign of pancreatic cancer, a type of cancer famous for its silence in the early stages. Pancreatic tumors often form in the body or tail of the pancreas, a location deep in the abdominal cavity close to many important nerves and organs. As the tumor grows, it can put pressure on the surrounding nerves, creating a feeling of widespread pain, not only in the abdomen, but also spreading to the middle back, or forming a band of pain across the waist, sometimes making the patient think that he or she has a disease of the spine or stomach. The pain associated with pancreatic cancer is characterized by dull, persistent pain that increases over time. Many people describe it as a deep, vague pain in the abdomen, sometimes throbbing after eating or lying down. When sitting and leaning forward, the pain may be slightly relieved. This is a fairly typical sign of pancreatic cancer, as changing posture reduces pressure on the tumor and surrounding nerves. The danger is that this pain is easily confused with stomach pain, sciatica, or back pain due to sitting too much, so patients often only seek temporary pain relief without going to the doctor. Meanwhile, if the pain lasts continuously for several days to several weeks and does not respond to conventional pain relievers, then you should consider it a serious abnormality. In addition to pain, patients may also experience insomnia, loss of appetite, weight loss, and physical weakness, significantly reducing their quality of life. These accompanying symptoms, if appearing at the same time, will further strengthen the suspicion of pancreatic disease. Symptom number 8: dark urine, a small signal, a big warning from the body. While many people are used to paying attention to their blood pressure, weight, or blood sugar levels, an easily recognizable but often overlooked sign is the color of their urine. In fact, changes in urine can reveal a lot about your health, especially persistent dark urine, a symptom that may be related to pancreatic cancer. When the pancreas is compressed by a tumor, it often affects the common bile duct, the pathway that transports bile from the liver to the small intestine. This blockage prevents bilirubin, a yellow pigment produced when red blood cells break down, from being able to follow the normal path to be excreted through the stool. Instead, bilirubin accumulates in the blood and is excreted through the urine, causing the urine to become unusually dark, even if you drink enough water. Urine color can vary from dark tea yellow to dark cola brown, and importantly, it does not return to normal even after drinking lots of water or changing your diet. This is not a harmless sign alone, but an early manifestation of bile duct obstruction and liver stress, an indirect but important sign of pancreatic cancer. Many people mistake dark urine for dehydration or poor nutrition, and often subjectively think that drinking more water is enough. However, when accompanied by other signs such as mild jaundice, persistent fatigue, pale stools, or dull abdominal pain, this can be a clear picture of liver bile disorders due to damage to the pancreas. It is worth noting that the change in urine color often occurs before jaundice appears clearly. That means that if you detect it in time, you can completely go for a checkup and detect pancreatic cancer at an early stage, when the chance of successful treatment is still high. If you notice that your urine has an unusual color for several days in a row, especially if it is unusually dark, despite drinking enough water, do not take it lightly. Proactively checking your liver, gallbladder, and pancreas functions can be a smart move to help you detect one of the most dangerous diseases today. After going through the 8 early warning signs of pancreatic cancer, with you. Perhaps the most obvious thing we can learn is this disease is not as silent as we think. It has clear signals but is cleverly camouflaged under very common symptoms, from fatigue, bloating, to back pain or discolored urine. Because it is so similar to common disorders, many people have missed the golden period for early detection and timely treatment. You see, it is no coincidence that the 5-year survival rate of pancreatic cancer is so low. A large part of this is because most patients only discover the disease when it is in the late stages. However, the good news is that research has shown that if at least 3 of the 8 signs shared in this video are recognized early, the chance of detecting pancreatic cancer early can increase to nearly 70, a number that can change lives. We do not share this information to make you worry or panic, but to help you be more proactive in monitoring your own health and that of your loved ones. Sometimes just a small action, like going to the doctor early, scheduling an abdominal ultrasound, or getting a blood test can make a big difference. And don't forget that health is not something that is obvious. It is something that needs to be cared for, observed, and maintained every day. Listening to even the smallest changes in the body, not ignoring prolonged abnormal signs, is the best way for you to proactively protect your life. If you find this video useful, please share it with your relatives and friends. Who knows, that might save someone from this dangerous disease. Don't forget to click follow the channel. Turn on the notification bell to continue receiving useful, accurate, and practical health sharing from us. Thank you for watching until the end of the video. Health is the most precious asset, and knowledge is the best way to preserve it. See you in the next videos.